Diagnosis. Part 3. Disease conditions. 1. Malignant melanoma. CA skin. 2. Gastric cancer. CA stomach. 3. Cardiomyopathy. 4. CVA. 5. Cholelithiasis and cholecystitis. 6. Cushing syndrome. 7. Cystitis. Lower UTI. 8. Diabetic ketoacidosis. Malignant melanoma or CA skin. The most serious type of skin cancer. Melanoma occurs when the pigment producing cells that give color to the skin become cancerous. Nursing diagnosis are acute pain related to surgical incision and grafting, anxiety and depression related to possible life threatening consequences of melanoma and disfigurement, deficient knowledge related to early signs of melanoma, gastric cancer or CA stomach, cancer that occurs in the stomach. Risk factors may include smoking and a diet of highly processed or salty foods. Nursing diagnosis are anxiety related to disease and anticipated treatment, imbalanced nutrition, less than body requirements, related to early satiety or anorexia, pain related to tumor mass, anticipatory grieving related to diagnosis of cancer, deficient knowledge related to self-care activities, cardiomyopathy, an acquired or hereditary disease of the heart muscle. An acquired or hereditary disease of heart muscle, this condition makes it hard for the heart to deliver blood to the body, and can lead to heart failure. Nursing diagnosis are decreased cardiac output related to structural disorders secondary to cardiomyopathy or dysrhythmia, ineffective cardiopulmonary, cerebral, peripheral, and renal tissue perfusion related to decreased peripheral blood flow, impaired gas exchange related to pulmonary congestion secondary to myocardial failure, activity intolerance related to decreased cardiac output or excessive fluid volume, or both, anxiety related to the change in health status and enroll functioning, powerlessness related to disease process, non-compliance with medication and diet therapies. CVA, cerebrovascular accident, also called AS stroke, damage to the brain from interruption of its blood supply. A stroke is a medical emergency. Nursing diagnosis are impaired physical mobility related to hemiparesis, loss of balance and coordination, spasticity, and brain injury. Acute pain related to hemiplegia and disuse. Deficient self-care, bathing, hygiene, toileting, dressing, grooming, and feeding related to stroke sequelae. Disturbed sensory perception kinesthetic, tactile, or visual related to altered sensory reception, transmission, and/or integration impaired swallowing. Impaired urinary elimination related to flaccid bladder, detrusor instability, confusion, or difficulty in communicating. Disturbed thought processes related to brain damage. Impaired verbal communication related to brain damage. Risk for impaired skin integrity related to hemiparesis or hemiplegia, decreased mobility. Interrupted family processes related to catastrophic illness and caregiving burdens. Sexual dysfunction related to neurologic deficits or fear of failure. Cholelithiasis and cholecystitis. Cholelithiasis. A hardened deposit within the fluid in the gallbladder, a small organ under the liver. Gallstones are hardened deposits of digestive fluid. Cholecystitis. Inflammation of the gallbladder, a small digestive organ beneath the liver. Cholecystitis is often caused by stones that block the tube leading from the gallbladder to the small intestine. Nursing diagnosis are acute pain and discomfort related to surgical incision, impaired gas exchange related to high abdominal surgical incision, impaired skin integrity related to altered biliary drainage after surgical incision, imbalanced nutrition, less than body requirements, related to inadequate bile secretion. Deficient knowledge self-care activities related to incisional care, dietary modifications, medications, reportable signs or symptoms, fever, bleeding, vomiting. Cushing syndrome, a condition that occurs from exposure to high cortisol levels for a long time. The most common cause is the use of steroid drugs, but it can also occur from overproduction of cortisol by the adrenal glands. Nursing diagnosis are risk for injury related to weakness, Risk for infection related to altered protein metabolism and inflammatory response. Self-care deficits related to weakness, fatigue, muscle wasting, and altered sleep patterns. Impaired skin integrity related to edema, impaired healing, and thin and fragile skin. Disturbed body image related to altered appearance, impaired sexual functioning, and decreased activity level. Disturbed thought processes related to mood swings, irritability, and depression. Cystitis or lower UTI. Urinary tract infection. An infection in any part of the urinary system, the kidneys, bladder, or urethra. Urinary tract infections are more common in women. They usually occur in the bladder or urethra, but more serious infections involve the kidney. Nursing diagnosis are acute pain related to infection within the urinary tract, deficient knowledge related to factors predisposing to infection and recurrence, detection and prevention of recurrence, and pharmacologic therapy. Diabetic ketoacidosis. Risk for fluid volume deficit related to polyuria and dehydration. Fluid and electrolyte imbalance related to fluid loss or shifts. Deficient knowledge related to diabetes self-care skills information. Anxiety related to loss of control, fear of inability to manage diabetes, misinformation related to diabetes, fear of diabetes complications. Thank you for watching. Like, share, and subscribe.